Today's Ask the Expert edition is Dr. Monica Sanford. Monica, how did you get involved in the field of nurse practitioner, specifically cardiac care? What attracted you to this profession?
Oh, wow. That's a great question because it is actually my son was born. I was in business 30 plus years ago, and my son was born with a severe congenital heart defect. So when he was born, I saw the nurses at the bedside take care of him and care for him in the pediatric ICU and after his heart surgeries. And I said, I need to learn how to do that to learn how to take care of my son. So it was just so this is not wasn't just a job kind of selection. It was a passion and this purpose, then kind of purpose driven life that you hear about. It was a purpose to go back to nursing school to learn bedside nursing and then advance on to a nurse practitioner and then advance on to my doctorate in nursing to do everything I can at this level for publications and advocacy and outreach, things like that, as the nurse practitioner. But cardiac is because he was born with a severe congenital defect. Everything I've done since that has been cardiac ICU, cath lab, anything having to do with cardiac to learn the management, medications, the treatments, procedures, anything at all having to do with cardiac has been my focus since I started. So, and I love it, and that's what I do now. As far as when I do advocacy, it's for cardiac care in the community, cardiac care for my patients, things like that. So thanks for asking. Yeah.
What specific training or certifications do you have?
As a BSN, I was a bachelor's in nursing and then went to advance. I have my what we call an AGACNP. I am a master's prepared. I'm a doctor prepared now, but I went on to for my master's and got a adult gerontological acute care nurse practitioner board certification. So that is a national board certification. And then I went on for my doctorate. So doctorate in nurse practitioner or nursing practice. But I also have my certifications are mainly around cardiac, anything advanced cardiac life support, things like that I need for the bedside. But my board certification is acute care nurse practitioner.
Okay. What non technical skills or qualities are essential for success in your role?
Oh, wow. I would definitely say beyond the clinical aspect, it is leadership. Any kind of leadership qualities that you have to listen, to collaborate. Collaboration in what I do is huge important with the my colleagues on the team or my physicians on the team, and then lead an entire practice or clinical area or just the team itself and to improve outcomes for the patients. So I think management, definitely managerial, time management skills from the minute we walk in the unit at 6 a.m. to the time we're leaving at 6 p.m. after is all your time management, the acuity level of the patients, what you're doing throughout the day to collaborate with all your colleagues. So definitely leadership and time management, I think.
Can you share some examples how you've used your skills to add value to your role in the hospital setting?
Clinical skills, definitely. I use it to my background and I don't want to say expertise because I still learn every single day, even though I've been doing this 25 years. But my clinical fundamental basic and everything I do in the hospital, I use to educate my patients. So everything is about educating patients, educating their families, educating them on their treatment plans, and everything now is very patient centered care. So I want them to be involved. I want them to have input of their plan because that will help also lead to adherence and compliance. So if they know why they're doing something, then they are more apt to follow that plan. So a lot of I take my clinical, and even though it may be technical clinical skills, I have conversations with my patients and families and educate them to know why we want to do something and why we want them to do something to help lead to compliance and help lead to kind of a generational change. So then they go back and teach their families and their kids and things like that why they need to do certain things to for heart health.
What are the biggest challenges you face in your field?
Again, going back to probably leadership and time management, it is sometimes when I say time management, it's I work inpatient cardiology at an enormous facility in Vanderbilt. So just the challenges itself is from the minute we walk in is kind of triaging the acuity level of the patients, the who, collaborating with so many different specialty teams and all of them, a bunch of cardiology specialty teams, but we also have a bunch of other infection disease teams and pulmonary teams and surgical teams. That's a challenge, but a welcome challenge. And we love the evaluation that they bring and the recommendations they bring to put it all into your plan of care and coordinate that care and then discuss that with the patients. So clinically, not it's always a challenge to care for a patient holistically. When you see, this acuity factor, we are caring for somebody really high acuity at that point, but there's also an entire holistic patient behind that we have to take into account for their community and, for them in the, their socioeconomic status. When I give a medication, I have to then look back and say, are they going to be able to get this medication and afford this medication? Things like that then I have to collaborate with pharmacy or a possible outpatient pharmacy, a rehab center, things like that can be challenging, but it takes a team, it takes a whole village to take care of that one patient. Let me tell you.
What are some common misconceptions about cardiology, your area of expertise, that people outside the field might have?
That it is very easy to just give a pill or take a pill and the patient's going, I'll just take this and I can, it'll fix my blood pressure, or I'll take this and it'll fix my diabetes, or I'll take that. Just the adherence factor is, a lot of, when I say it's a misconception, it's when we assess somebody and then develop the plan and we assess them, evaluate them, develop this plan, and that is just so easy. And it's not that easy. It's just, it takes a lot of, after the diagnosis, that's just the first part type thing. So then it's a lot of lifestyle management, lifestyle, education, and it's not easy for us. And I know it's not easy for the patient. So we definitely, again, comes back to the education and the holistic, taking into account every kind of social determinant of health we can. So that's probably the biggest misconception or challenge is that it's so easy for me and it's so easy for the patient, and it's not easy.
And finally, what advice would you give someone if they're interested in transitioning from the general role of nurse practitioner to a more specific area of expertise?
Oh, I love that question because I want everybody to be a nurse and a nurse practitioner. But if they are a bedside nurse, and I talk to nurses all the time, and I asked one yesterday, what do you want, what specialty do you want to go into? And I would love it. Everybody said, I have a passion for cardiology, but she said labor and delivery. So the same for every specialty is that first year out of nursing school is to invest in yourself, invest everything you can into certifications. My first year out of nursing school, I took and this was 25 years ago, took a course on critical care management, cardiology, critical care, balloon pumps, cardiac medications, EKGs, telemetries, anything I knew, because I knew going in because of my son that I knew I wanted to do cardiology. So that first year out, everything was cardiac. So by the end of that year, even if I had to pay for the classes myself, even if I didn't quite understand kind of what was going on in the critical care aspect, by the end of the year, it all started coming together. So just invest that one year into, so many certifications, classes, continuing education.
Wonderful. Well, thank you for joining us on Ask the Expert.
Yes, thank you for having me.